Time to answer some of your medical questions, some of them sent in by viewers, and a lot of these this week are pretty common questions. Joining us live to answer them is News Channel 5's medical specialist, Dr. David Soria. He, of course, is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for joining us each and every Wednesday. All right, let's jump right in. Our first question is one a lot of University of Florida football fans are interested in. Florida coach Urban Meyer says the chest pain that bothered him in the last 3 years has been diagnosed as esophageal spasms. So can you explain what that is and how significant is this?
Yeah, sure. Well, fortunately for him, that's all it was. When it presents, it can be very painful. It is chest pain. And the big difference with that versus heart pain is that heart pain can kill you. Esophageal spasm pain is pretty benign. It's the squeezing of the esophagus, the smooth muscle of the esophagus, of the food tube that connects from the throat to your stomach, starts to squeeze. And it's basically like a cramp, but in the esophagus. Very painful. Can be triggered by hot or cold liquids and even food. And typically it happens after you eat. Now, the one thing I want to make sure of is that this is chest pain. So if you feel this, I don't want you to sit at home thinking that it's benign or that you can self-diagnose. Anytime you have pain like this, I want you to come to the emergency room, come see us. We'll decide whether or not we feel it's benign or not. But typically, you can tell relatively easily based on the symptoms and how they present. But again, leave that up to us.
And that's different than acid reflux.
Acid reflux is much different. However, it can be a risk factor for esophageal spasm. Yeah.
Okay, good to know. All right. Our next question coming to us now from Sue in Vero Beach. Sue wants to know, what kind of doctor do I need to see about a cyst on my finger?
Yeah, a cyst on a finger, there's not too many things that can cause that, although I do want to make sure that what you see is not an infection. If it's red or tender, warm, very painful, okay, that's probably an infection. I want you to come see us or a doctor right away because it's probably going to need to be cut open. Now, a cyst is typically not painful. It's spongy, and the most common cause is ganglion or mucus cysts, and that you need to see an orthopedic specialist. That orthopedic specialist can do many different things to remove that, but typically it's painless, doesn't cause a problem, and most of the time they go away on their own.
Okay, all right. And now our final question today, this is a popular one, I would imagine. Can you get tennis elbow if you don't play tennis? And what can you do to get rid of the pain if it's getting worse?
You sure can get it if you don't play tennis. Matter of fact, the movement that is going to cause it is this, is pronation, because it's a tendon that connects from the forearm to the outside of the elbow. Golfer's elbow is the other side. It's the medial or the inside, and that's this type of movement. So anything that you painters, plumbers, rakers, landscapers very commonly present with what's called lateral epicondylitis. So what do you do for it? Well, you got to rest it because, again, it's an overuse injury and it causes pain right here. Otherwise, you can do steroid injections, take medications like anti-inflammatories, and worst case scenario, it may require surgery.
All right, so Wimbledon or not, you can get it, right?
That's right.
All right. Dr. David Soria, thanks so much for answering all of our viewer questions as always. We'll see you next week, and we'll see you right after this short break. Stay with us.